Hey everybody. So today I wanted to talk to you a little bit about chronic pain, specifically chronic pelvic pain. So in my scope of practice as a pelvic floor physical therapist, chronic pelvic pain can show up as anything from vulvodynia, pain in the vulva, to pain with sex. It can be clitoral pain. It could be pain anywhere in the pelvis, in the SI joints in the back, or in the pubic symphysis in the front. Chronic pain principles apply to any type of pain in the body. So outside of that would be even back pain, neck pain, joint pain, soft tissue pain. Any kind of pain that we've experienced for a duration of longer than 12 weeks is considered to be chronic pain. Chronic pain does not behave in the same way as acute pain. So think like if you sprained your ankle yesterday, that type of pain is going to behave differently. And so we need to treat it differently. I think it's really important to understand where chronic pain comes from and why we have it. So let's take a look at our pain system and how it operates. I think a really good way to think about this is with an example. So let's think like if you were to step on a nail. That's information that you would want to know, right? So your foot creates a signal, sends it up to your brain and says, hey, there's tissue damage, something has changed here. Your brain can then take that information, process it, and it creates a pain signal so that it brings it to our conscious attention so we can do something about it, right? You would want to be able to take the nail out of your foot, clean the wound, take some rest, stay off of that tissue while it heals. In a happy, healthy, normally functioning pain system, what we would expect to see is at the time of the tissue injury, so when you stepped on the nail, that pain signal spikes, right? So we have a spike in pain. As that tissue heals over time, we would expect to see that pain signal decrease over time. So eventually we get to a point where we have tissues healed and we're pain-free. What happens in about a third of the population is that as that tissue is healing, instead of the pain signal decreasing, that pain signal stays the same. So what does that tell us? That tells us that now that pain signal is no longer correlated with tissue health. Those are now two separate things. Overall, this tells us that our brain has become sensitized to pain and it's sending out that pain signal when there's not necessarily a need for it. So another good way to think about this is if pain was an alarm signal, like on a house, right? An alarm system, let's say. We want it to be sensitive enough that if someone's trying to break down the door, that alarm goes off. We don't want it to be so sensitive that if a leaf blows by the front door, that the alarm is going off. Since this is an issue with our nervous system and our brain, we need to treat the nervous system and the brain rather than just thinking about the tissue itself. Oftentimes this can show up as increasing pain with the same level of activity. You know, I used to be able to let's say I used to be able to walk for 5 minutes pain-free. Now I can't even walk for 1 minute. What's changing? This type of pain can be really alarming because it's really hard to understand because it's not logical. It doesn't make sense. It feels really overwhelming, and it's quite difficult to kind of get a grasp on what we can do about that kind of pain. What we do is we take a look at, okay, what does the nervous system need to feel healthy, happy, whole? Our nervous system in general needs sleep. It needs cardiovascular exercise for oxygen, and it needs graded exposure to quote unquote threatening activities. This is going to look very different depending on exactly where your pain is, what are your triggering activities or symptoms, how long have you had that pain, and where you're at kind of functionally, physically at that point. So every single person's plan of care is going to look different, and that's where a licensed physical therapist can be really helpful in identifying where you are right now and the steps that you need to take to get back to your preferred level of function. The good news, and something that I tell all my patients, is even having this baseline level of understanding about pain already starts to reduce the threat to your brain. Having that understanding of, oh, okay, I'm having more pain right now. My brain is feeling really sensitive, or my nervous system is feeling really sensitive, rather than, oh my gosh, I'm not getting better. That tissue's getting worse. I'm never going to heal. I'm not going to be able to go back to work. How am I going to support my family? All of these things can kind of snowball, but having that recognition to say, oh, okay, this is a nervous system issue. I know that I didn't get good sleep. I've been sick and I've been very stressed about XYZ. it can help to take some of that threat away, which inherently helps to reduce that pain. So chronic pain is a really, really complex topic, and we could talk about it for an hour. There's a blog post as well that you can read up on some of these topics as well. But if you have any questions, don't hesitate to reach out.